Hello, my name is Dr. David Ting. I'm the Chief Medical Information Officer for the MGPO, and it's my pleasure to introduce for today's two things Dr. Inga Lennis, who is our Senior Vice President for Ambulatory Management, and very importantly, during the COVID crisis, she is the Incident Commander for Ambulatory Operations for our hospital. Today, Inga is going to be talking to us about the RACC clinics, the routine ambulatory care of our COVID positive and COVID risk patients. Inga, thank you for being here. And our doctors are hearing about RICs and RACCs. What's the difference?
Thank you, David. It's great to be here. The RIC is a clinic that we stood up about a month ago, and now we have several locations. RIC stands for Respiratory Illness Clinics, and those were the ambulatory areas that we stood up to be able to see patients with suspected COVID, people with respiratory illness symptoms who also had moderate risk factors. And we have had locations at 175 Charles River Plaza, the Ambulance Bay in the Lunder building, and also in Chelsea. We've consolidated the 175 CRP location into the Ambulance Bay most recently. Those continue to be areas where we see ambulatory patients that we suspect COVID and need COVID testing for who have not previously been diagnosed. The RACC is a new endeavor because about a week or two ago, it became clear that patients who in the ambulatory arena who were diagnosed with COVID may need to access ambulatory care. They had needs that couldn't be deferred and also weren't appropriate for virtual or telehealth care. For some of the examples of this were OB patients that needed to be examined in person who might be COVID positive or have COVID status. Another example is a postoperative patient who has COVID status who needed a wound check, things like that. Patients who were had COVID status that were discharged that for some reason needed to have an ambulatory check in person. And so over the past 2 weeks, we've developed a concept of the RACC, which is the ambulatory care. And the first RACC location that we've opened is in Yawkey Building on the 7th floor. It's within the Cancer Center. Cancer was one of the areas that expressed the need early to be able to see COVID positive patients. And so there is a clinic area within the Yawkey Building and also an infusion area for both oncology and medical infusion for COVID positive patients.
This sounds like such a great concept. Why wouldn't we open up RACCs all over the institution and even within clinics to have COVID positive lanes within all the clinics?
Well, certainly that may be our future, but right now we are really constrained by our protective equipment availability, and we want to be good shepherds and good stewards of the PPE that we have. And as we're learning about the best way to address this, we're starting conservatively. So starting with one clinic. This is a clinic that's also different from the RIC in that the RIC is staffed with clinicians to see patients who arrive. The RACC is a space. It's a space that's configured appropriately with infection control to have the space that would protect our employees. Patients sit 6 feet apart in the waiting room. The appropriate PPE is available. There's donning and doffing monitors from infection control that are in the RACC. So the RACC is different than the RIC in that the RACC is really a space for any ambulatory provider to access to be able to see a patient that can't be served with telehealth. So it's a little bit of a separate concept. And you're right, we may have to build RACC space in a variety of different places to be able to function in the future. But this is just the first of those spaces, and it's available to any person who sees ambulatory patients.
I see. That's so helpful. Can you help us unpack a little bit what the workflow looks like? Let's say I'm a physician who has chronically ill patients. A certain patient might be positive for COVID or COVID presumed. They need to be seen. We can't do this as a virtual visit for that particular patient. Talk us through the flow. How would I refer that patient to the RACC space, schedule that time, and then who sees the patient? It sounds like it's myself or somebody from my team.
That's right. So we have already done extensive training with the practice managers on this particular workflow. So my hope is that all any clinician would need to do is to reach out to their practice manager and scheduler and say, I have a COVID status patient who I need to see, or a representative from my group will need to see. I need them scheduled into the RACC space. All practice managers have been trained in how to do that. The patient will be scheduled on your cadence schedule as the clinician seeing the patient, so you'll see them just the way you see every other patient on your cadence schedule. But we use the RACC space as a scheduled resource so that the patient is also scheduled into the RACC area, so that area knows the patient is coming. So they will also be contacted by the RACC staff before they arrive. The patient is contacted. They are told specifically where to park, what elevators to use. They're navigated into the clinic so that they are not mixing with non-COVID status patients. And they're given all of that information before they arrive. Providers who come to see patients in the RIC are also the RACC, are contacted before the visit and sent the video on proper donning and doffing, just like RIC providers are sent, so that they have some training before they arrive in proper PPE use. So you do need to make sure that you work with your scheduler to provide enough time so that if you don't normally work in Yawkey, that you have time to walk there to be able to see the patient that you scheduled. And it doesn't have to be the primary provider. Some groups have come to us and said, we'd really like to take a provider, for example, from a certain discipline, and be able to schedule all of the patients that can't wait for our care and have that one provider that's a designate of the specialty see the patients. That's something that we can do as well. We just will work with every group who may want to do that. Lastly, I'll say that other groups have also come to us and asked us for tours of the RACC. So if as a specialty, you would like to come and see the physical space, we've tried to create a space that's minimally appropriate for everyone. So it has, for instance, stirrups for patients, OB patients and GYN patients to be seen. It has minimal supplies for wound care for post-operative patients, things like that. We will continue to work with every specialty to do the best that we can to make the space useful for you. So just be in touch if that's something that you're concerned about.
So the RACC space is really a safe and well-supported area for clinicians to send their patients who need to be seen, patients who have COVID status. You earlier mentioned, Inga, infusion. So what if you have a patient who needs an infusion or even phlebotomy? Can you send them to the RACC?
Yes. So the RACC infusion space is a collaboration between the medical infusion area and the oncology infusion area. You would access the infusion area the same way that you normally would. Like for oncology, you would go through the proper channels for infusion in oncology. And for medical infusion, you would go through the same channels that you normally do. But because the patient would have a COVID flag in the system, instead of being scheduled in the area with they would be encountering non-COVID patients, they would be scheduled into the COVID area, which is on the 7th floor of the Yawkey building, so that we keep all COVID status infusions together.
Well, thank you so much, and thank you, Inga, for you and your team and the work that's being done here to support our clinicians and patients and staff through this COVID era.
Thank you, David, and thank you to everyone out there that's listening. Be well.